genetics from Sir Gangaram Institute of Medical Sciences, and he is also a president of Sickle Health Society of Amravati. Sir is also a lecturer in the Department of Pediatrics, PDMMC, Amravati. So he will be talking on sickle cell disease, a misdiagnosis. I welcome Dr. Tayade, sir. Over to you, sir.
Yeah, thanks, Dr. Vikram. If I'm Hello.
Sir, your voice is a little bit cracking, sir.
Okay. Is it okay now?
Yes, sir. Better.
Is it okay now?
Yeah. Better, sir.
So, okay. So I am talking about the sickle cell disease, which is, as we all know, the common problem in our region. And so background, it is a sickle cell disease is one of the most common hemoglobinopathy, not only in India, but also in world. Very common in our region and most of state in 1 minute, please. Video is not there. Excuse me, Vikram, video is not there.
Sir, we can hear your video also.
Very common in our region.
Hello.
If you are you able to see video.
Hello. Yes, sir.
Hello, Vikram. If video is there, my video is there.
No, sir. We are not able to see the video.
Okay. So what's the problem? Okay, no problem. So it is very common in our region of the state in India. It is commonly considered a problem of only SC and ST community, but I want to tell that it can be seen in every community. It has very varied presentation, and so many times diagnosis may be delayed. Can present first time at any age, so age criteria doesn't rule out sickle cell disease. It is more than what we read in our book. So be prepared. Sickle cell disease can be present in any way to you. Prevention is the best way of cure. And recently, some new medication are arrived, and we can treat very well with the sickle cell disease patient with this medicine. Bone marrow transplant and gene therapy is the curative treatment. So in this, as actor can present with the various roles. Similarly, sickle cell can present to you with any kind of manifestation, which can be seen in our further cases. So this is a case one. It is a 9-year-old male child admitted with history of fever since 8 days. This is a recent case admitted in our Punjab Rao Deshmukh Medical College with history of fever 8 days, abdominal pain since 3 days, vomiting away, and altered behavior since 5 hours. On examination, child has panneuterous hepatosplenomegaly with GCS of 9/15. Suspecting acute failure with hepatic encephalopathy, we have done some investigation. Investigation show hemoglobin of 5.4 with PLC count of 65,800 with polymorphic predominance and platelet of 42,000. We rule out dengue and HIV, HBsAg, SCV was negative. HIV and HEV was not possible because the kit was not available at that time in our hospital. Liver function test was grossly deranged with SGOT and SGPT both 4,000s and bilirubin was 16.62. And in spite of treatment of hepatic encephalopathy and conservative management, a patient was survived and succumbed to illness after 3rd day. So after his death, the reports of electrophoresis also arrived and show that patient is suffering from sickle cell disease. So sickle cell disease as hepatopathy and hepatic encephalopathy can be seen. And till now, I have seen 3 patients which are present with severe encephalopathy, hepatic encephalopathy like presentation, out of which 2 are survived. and this patient was not able to survive. This is the case 2, which is a 23-year-old male roaming around to many doctors for severe back pain, and some orthopedician advise him for MRI spine, and the MRI radiologist done the MRI spine and give the diagnosis on that MRI that it is the possibility of sickle cell disease in this patient. And when he came to me with this report, he doesn't have any splenomegaly, mild anemia is there, and his HB electrophoresis show uh, that he had a sickle cell disease. So sickle cell disease can be done by sometimes radiologist also if we don't keep the different presentation in our mind. Case 3, this is a 6-month-old infant, came with history of recurrent fever and joint swelling and irritability. On examination, he had pallor, hepatosplenomegaly, and investigation show that he is suffering from sickle cell disease. So we can see sickle cell disease can present at any age. This child is a 6-month-old, and for previous case, the person is of 23 years old. This is a fourth case. A 4-year-old female child came with history of abdominal distension and vomiting. UHG suggestive of subacute intestinal obstruction. So patient goes to surgeon, and as there is no active surgical management, patient was admitted in our hospital. And on examination, she had pallor, splenomegaly, and we came to diagnosis of sickle cell disease with mesenteric ischemia in this patient. So it is a form of vaso-occlusive crisis and can present as a subacute intestinal obstruction in sickle cell disease. This is case 5, a 27-year-old female with history of 3 recurrent abortion. During this pregnancy, she was evaluated for anemia, and this time she was diagnosed as a sickle cell disease. In her history, there is no past history of icterus, blood transfusion, or bone pain. So she diagnosed first time at 27 years with only history of recurrent abortion as a sickle cell disease. So you can see the clinical features at diagnosis. At diagnosis mean when this patient was diagnosed as a sickle cell disease first time. So this is data of 180 patient in our Amravati district, where we can see common features like anemia, fever, recurrent VOC, pain, icterus. All these symptoms can be present in the patient, but they can also have some unusual features which we have to keep in mind. With this, they can go to first time, may go to the surgeon, may go to physician, or may go to some orthopedician, or may go to the eye specialist, or sometimes see a neurologist also. These are the subacute intestinal obstruction, hepatic encephalopathy like presentation, may have just loose motion or constipation like presentation with subacute. Then they may have stroke, severe respiratory distress, non-healing ulcer, and sometimes the child may come with near death, or patient may be brought as a death patient also. So age at the time of diagnosis, in this chart we can see the 10% of patient, approximately 10 patient of patient diagnosed at below 10 years, below 1 year as a sickle cell disease, while similarly 10% or more than 10% patient diagnosed after 20 years as a first time as a sickle cell disease. So age is not a criteria to rule out the sickle cell disease. In this my study, the adult, as I am a pediatrician, adult percentage may be low, but we know that sickle cell can present at the adulthood also as a first time as a sickle cell disease. So most of us think that in sickle cell disease there is a atosplenectomy by 5 years of age, and if the spleen is present, that rules out our diagnosis of sickle cell disease. But we have also seen that in less than 5 years, approximately more than 50% have a splenomegaly. But surprisingly, after 5 years also, 50% of patients may have the splenomegaly still present in them. So presence of splenomegaly doesn't rule out sickle cell disease, especially in our Indian patient. So something about treatment. So whenever the patient with sickle cell disease came to us, we think that it is the fluid, and fluid is the main treatment for the sickle cell disease. But remember one thing, don't overhydrate the patient, maintain U volume. Then we afraid about the painkiller. We give painkiller as a SOS basis, but don't afraid of painkiller. Give round the clock painkiller. Use special pain scale or different pain scale to know what is the severity of pain in this patient. Managing pain of the patient is very important in sickle cell or any disease patient. As per NABH criteria, that pain scale is in the our protocol, admission protocol in the NABH criteria. So don't afraid of painkiller. Give round the clock painkiller in patient with sickle cell disease. Then start hydroxyurea if there are the indication for starting it. Don't transfuse routinely. Whenever the patient with sickle cell disease come to us, if he has a VOC, if his hemoglobin is 8, we transfuse that patient, but it is not required. So with patient with sickle cell disease, we have managed with hemoglobin of 5 and 6 without transfusion if they doesn't have fit for the indication for transfusion. So value of hemoglobin is not a criteria to transfuse sickle cell patient. It is based on the what is their symptoms, how he presented, and what is the indication for giving the transfusion. Then they can have pregnancy and they can give birth to the child. So don't tell them that they cannot have pregnancy or pregnancy may not be possible in them. And if we treat them properly or they take care of themselves properly, then they can have also a long life. So we have to counsel the patient that sickle cell disease doesn't mean that patient will not survive beyond 30 years or 40 years. He can have a long life also. Newer therapy, they are the L-glutamine, which is FDA approved in July 2017, which is almost after 20 years of hydroxyurea. Hydroxyurea was approved for sickle cell disease in 1997, but after 20 years, we get L-glutamine approved for the sickle cell disease for treatment more than 5 years of age. But my personal experience show that L-glutamine in our Indian patient increase the vaso-occlusive crisis. So I am not very much happy with this drug. Then second drugs recently approved, but not at present not available in India is voxelotor, which is FDA approved in July 2019. And another drug which is now just December 2019 approved was the crisanolol, which is given once a month therapy and is shown to be have some very good effect in the patient with the sickle cell disease. So these are the new therapy in the sickle cell disease. There might never end without telling about the prevention, because in this type of genetic disorder, as we all know, prevention is better than the cure, and we should always try to prevent this disease in there. Whenever you diagnose any patient with sickle cell disease with trait, whether he is trait or disease, you have to try to counsel the patient and the family for prevention of this disease. So I check every patient by HPLC, which is required to be done only once in his lifetime. Then I have also tested myself for hemoglobinopathy, and I request everyone who is attending this lecture and everyone that check yourself, your children's, your patient for this hemoglobinopathy, which is easily preventable if we diagnose them in time. If we know that we are trait and we avoid marriage with the trait, then we avoid the birth of deceased child. So our aim is lest there would be no child born with sickle cell